Hey, what's up, guys? Welcome to this episode of Clay's Cortex, the podcast. Really excited for today's episode. I have known today's guest for a while. It's been a while, and to be honest, I didn't know she was a physical therapist when I first met her. And then as I figured that out, it was really cool to get to know more about her and talk with her about courses she was going to, learning. Love her family, love her husband. He poured into me a lot growing up, more so when I was starting my first job. He said something to me that I'll probably never forget about a butterfly and a cocoon. He's got a lot of knowledge, and so does Cynthia. So today we're gonna be talking about a couple different topics. We're talking about, approaching training with female athletes. And so today's guest, as you guys can see on the screen, is Cynthia Rainey. She's a doctor of physical therapy here in Washington. And I'm actually gonna, like I do every time, I'm gonna be a little bit quiet, and I'll let Cynthia talk about yourself, your background, what you're doing, and introduce yourself.
Sure. Thank you, Curtis. Thank you so much for that intro. And I'm honored to be on this podcast today. And like Curtis said, we've known each other for several years. So it's a blessing. I love his family and Jackie as well. So as he mentioned, I'm Cynthia Rainey. I've been a physical therapist. This is my 18th. I'm going to my 18th year. I went to University of Washington, go Dogs, for my undergrad, and then went to University of Puget Sound for my graduate studies. Graduated in 2004. It has been a journey. I tell the younger generation who is interested in physical therapy, it's just one of the best fields out there. I work in a private practice. I've always been in private practice. Predominantly my population of people is orthopedic, sports medicine. So I tell people I treat pretty much neck to toe, and I'm really passionate about the field. There's so much to learn. I think if there's a moment that you think you know it all, there's another challenge, and that's what I love about it. There's always something to learn. I love collaborating with people like Curtis, with chiros, with massage therapists, with naturopaths, acupuncturists, you name it. I'm all about that. I'm pretty much I'd like to consider holistic approach as far as it comes to physical therapy. I don't believe I'm an island. I believe we need everybody for mind, body, and soul. So I'm excited to be here. So thank you.
I love it. Yeah, that's great. So I thought about asking her to come on an episode, guys, so we could talk about essentially really what she wanted to talk about. And so it was really cool, the topics that she brought up. And the main one we're gonna be talking about is essentially approaching training with, female athletes and some of the things that she thinks about. She's been pretty passionate about this, as she told me. And so we're gonna kind of dive into that a little bit. So I'm trying to think of where I would frame that. So say, for example, if I give a hypothetical, right? So say I got a female athlete, she's in high school, she gets injured, right? Whatever the injury may be, she comes and sees you. What are some things that you may first start with and kind of progress through, And you could pick an injury if you want. I mean, I'm just kind of like any injury,
absolutely. Yeah, no, that's great, Curtis. So I guess what could help out with that is that I started my career working with spondylolisthesis, or spondies. And I started with working with gymnasts. I worked down in Renton. So we had gymnasts, we had a lot of swimmers, and we know that they have a high rate of spondies, a lot of fractures in their back. So we can take that scenario and work from there. With a spondee, they'll come in and let's say they'll be teenager and 13, 14. We'll typically talk about history to get to the nitty gritty. With females, we'll talk about when they started their menstrual period. We'll talk about their diet, their nutrition. We talk about a lot of things, their sleep, their health in that aspect, their mental health, to a degree, because I know where my boundaries are. But I just want to know the whole person to see what that looks like. Sport definitely is important with gymnasts, high level gymnasts, especially if they're at that level 9, level 10, going to college. Or aiming to go to collegiate athletes. We really have to look at that whole person, because how we start their rehab and how their whole journey through rehab really depends on what their goals are. So that is just the subjective alone. So in the subjective, definitely we work closely with a particular doctor in the area who does see a lot of spondies. So she has a certain protocol that in the hierarchy we'll put into our own protocol. And so that in the subjective, it's everything I just listed. Then we'll go through the objective exam. And through my experience, I started my training with a lot of manual therapy. So in that manual therapy experience, we are expected to have fast assessment skills. So for a lumbar spine, we'll check range of motion, we'll check flexibility, strength testing, PA pressures, we call them posterior anterior. We kind of, especially for a spondy, if we're keeping to that example, we'll press on their spine, see where they're irritable. I think something we'll talk more about in this podcast is looking at the whole person. So as I've gone through my career, I have dabbled. I call myself a dabbler. I like to dabble in different philosophies. And one philosophy I've really dabbled in lately, and I've taken classes with Curtis on this, is called PRI, Postural Restoration Institute. PRI is what it's called. You can Google that. There's a wealth of information there. So what I'll do to incorporate in my objective exam after the normal range of motion, strength, flexibility, and PA testing is I'll look pretty much neck down, and I'll check their neck. I'll check their thoracic spine. A lot of times with spondies, they'll be very stiff through their thoracic spine. We know that to be the rib cage, the 12 ribs, hence the 12 thoracic spinal segments, and they'll be stiff there. So they can have compensation in their lower segments. Typically, you'll see a spondy around L4-5. 5S1 will be or even L2-3. I've seen those higher levels in the low back. And so check their flexibility there. So it's really a well-rounded approach. I'll even go as far as checking their breathing, see how they can expand from right to left sides, because that, especially with extension athletes with swimming and gymnastics, they need to be able to extend through there.
Right.
So there's a lot to that exam.
I love it. I think some of the cool things that stuck out to me when you're talking about it was, like, you talked about the subjective first, and I've found over my career, which is still very, very young, that's actually a very crucial part. I think that's kind of missed a lot. And I thought it was kind of cool when approaching female athletes is the aspect of, like, how are you eating? And I get the whole, like, mental side, like if I've got somebody where I'm like, oh, this is, because I think that, stress and so forth actually impacts pain and so forth down the line. And we'll probably talk about pain science a little bit from your perspective. And if I need to refer out, I'll refer out. And I've had a few times where that's happened. But I think one big factor which really stuck out to me, I did a paper on it in college, and my professor thought I was nuts, but kind of like, well, it's kind of cool, is this menstruation factor in female athletes. And my paper or presentation was on non-contact injuries with female athletes in menstruation. But how much of a factor do you think that plays for female athletes? I've never experienced this. So, like, how much of a factor does that play on their athletics, their training, their rehab? Like, what have you seen?
That's good. So with female athlete, my understanding with the menstruation part and also being a female is that it can affect in many ways. One is hormonal. So we know that, well, I'll give you an example. I had a swimmer I saw, and I was seeing her for low back pain. And she had the mechanical, we call it low back pain. There was weakness, there was pain in her low back. However, and she had pain with motion. However, it seemingly happened to be worse once a month around her menstrual cycle. So around that time, what we do know, and I'll try to be as careful as saying this because it's not my expertise, but what I do need to know is that during the time of menstruation and hence PMS, premenstrual syndrome, is going to be hormones. So our bodies as a female is meant to reproduce, meant to have babies. So about a week before, I want to say maybe 5 to 7 days prior to the actual cycle of menstruation, is that there will be hormones that will actually expand our uterus. And from the uterus, there's ligaments that we know attach from the uterus to the low back. And it can also, so that alone can be kind of like, oh, I'm having low back pain. Some people menstruate during PMS will have low back pain, or they'll have cramping in their front. I don't know if that's uterine contractions. I don't know, but we do know that it can be very hormonal. Then you can add stress and physical stress on top of that, postural, sport, whatever it might be, even sitting, and that can also aggravate. So we know with female athletes, we have the athlete, but then you have school on top of that. So there's a lot of factors that's like, well, they're sitting most of the day, right? So
Okay.
now we're hot on sit to stand desks and whatnot, but they're sitting most of the day and then they're going to their sport. And where do you find that balance? And then you have the hormones, and it's tough. So I will say what happens with female athletes when they come in, and we actually talk about that, is I typically ask them, like, how do you feel during these
Hmm.
times of the month, or is your period normal? So there is people, a lot of high level athletes, they don't have periods.
Right.
You
Right.
probably found
Yep.
that out in your research. They don't have periods. And then how does that affect the bone? We know that bone growth, and a lot of times when people stop, like especially these high level athletes, they'll stop and then they'll have this growth spurt. So
Hmm.
there's something to do with hormones, and we call it now with diet, like the nutrition part, it's more like a spectrum. Is
Yeah.
their caloric intake matching their outtake? So
Okay.
there's a lot of, that's why I love working together with nutritionists and doctors that believe in that, because I can't just see a spondy and be like, we can't talk about your diet. We got to talk about your protein, your
Hmm.
calcium, your vitamin D is huge.
Right.
So I think menstruation is a huge part, and it matters too what age group. I just learned this last year. I think the later they start has something to do with bone, and I can't
Yeah.
remember that piece. I'd have
I
to
think it's
look at it.
growth. Yeah, so it's
Growth.
essentially a system of growth, right? From what I've seen, that once that starts, it's like they're kind of peaking at that time of growth, essentially. Um, so if it's earlier,
Good.
right? If they're earlier versus like, 'cause I have some female athletes I get that come in for training, and maybe they have like, oh, my hip's sore, my foot's sore, like when I throw my shoulder's probably common with me, and some low back. I mean, I get a good amount of low back stuff or back. And usually, like to them, like the whole back is the back. So like I used to ask like, is it up here? Is it down here?
Right.
And whatever it is. But yeah, I think it's pretty interesting when you look at those factors. And I thought something you said that was really cool is you said, yeah, depending on, you have this hormonally going on, but then you also have stress, right? Of school, of sitting, standing, and then their activity that they choose to do, whether it's sport, it could be, I guess horseback riding, it could be volleyball, it could be gymnastics, swimming, whatever you said. Do you feel like when you're working with those athletes, those female athletes, do you feel that when it does get around that time, do you change anything with what you're doing? Like the amount of volume, the amount of reps, the amount of load, like, are you changing anything? Like, how are you thinking about that?
Yeah, thanks. All the above. I do consider that, because and a lot of timing is important, because then when do they have to perform? Let's
Mm,
say they know they're going to menstruate, or they're PMSing. It's like we may back off a little bit, say,
okay.
okay, we're going to do basics, maybe decrease the volume, the the resistance, all those things, and then so they can have a decent week that they're not just lethargic and not doing anything. They're focusing on diet, focusing on self-care, in hydration, things of that nature, whatever they need to do there, and then let them perform. So
Mm,
I do back off a little bit and have that balance, because I don't think a lot of people know that that can be such a trigger.
mm,
And because then it becomes complicated. Are you getting cramping and back pain because that's just the time of the month, or is
mm,
it a combination? It's hard to say. Some people will know that, like, oh, I'm just having my normal back pain. Others
got it.
don't, and then they think, and then it's frustrating, like, why am I not better? Well, there's a lot of factors that involve that.
Right.
So let's talk about what you did yesterday or the last 5 or 7 days. I don't think, a lot of times it's putting it in that person's court, like, there's so many factors. I usually will tell people, and we know with muscles, like, if you're gonna work them out, you're going to have maybe delayed onset muscle soreness. Like, those things
Okay.
are totally normal, but sometimes you got to look at the whole month.
Yeah.
Maybe so and so just went through a breakup. Maybe I don't know, maybe there's COVID. I mean, I just was on a phone call this morning with a mom, and she's frustrated because her daughter's not getting back to sport, and she's not a spondy yet, but she's got what do you call, early signs of a
Mm,
fracture, and it's frustrating. She's becoming depressed, and I mean, that's going on a pain science, but it's hard to, it's finding, it's meeting them in that place where they're at,
mm,
and looking at them from the perspective of not just today and yesterday. Let's see what's gone on this whole week. We know in athletics, things can change, and are they at the place that they need to, they're in tryouts, are they trying to make a team, so you got to kind
have
of
to.
balance it with, like, are we pushing you now, and then you can take a break in the next couple days, and
Right.
it's all what it's worth. What is it worth
Right.
right now?
I love it. I love it. I think that's super cool. And I think like you said, so how I did a podcast a while back with a buddy of mine's podcast, and he thought it was interesting that I talked about environment, right? We talked about a little bit yesterday on the phone when I was getting a smoothie. Yeah, talk about environment, how important environment is, right? And I think that we look at like environment as like say the gym. I think that's crucial, but there's also an environment here. And so like when I talk to somebody, our environments are interacting essentially. My words are part of that environment, my tone is a part of that environment. And yeah, I mean, the restrictions are being put on us right now and so forth. There's a lot of things I've seen it with athletes being down, and when they're in here and we're being safe and all that type of stuff, you can see their countenance change and stay at a good level, which is really cool. And I think that I'd actually like to transition. We'll keep that going from there. Maybe go into the pain science a little bit. You said, that's kind of a pain science thing, and how she's thinking about things and her body, like how her whole system is expressing itself outwardly to the world and people around us, right? You said like they're getting a little depressed, that kind of stuff. So how much of a factor do you think that plays into pain science?
Right. So I'll bring up some PRI stuff here too with Posture Restoration Institute. They will talk, so their philosophy, I'll just touch on that for a moment. Their philosophy is that everybody's a little bit mechanically rotated, because of our heart on the left side and our liver on the right side of our body. So we have big organs that are opposite each other. So we will tend to rotate a little bit to the right. So it's a very dogmatic approach. So just kind of bear lightly on this. But, and Curtis knows about this, but so they'll describe it as such that we will have a harder time breathing, and it's more harder on the left to exhale. And why this is key, and I'll get more into the pain science part, is that exhalation is super important. And we know that a lot of us are stuck in a sympathetic response.
Love it.
Sympathetic nervous system is our fight or flight. It is normal. We all have it. It is the way we see danger. And what can happen though is, let's say a lion is coming in the room right now. I'm going to sense danger and I'm going to want to run or maybe fight, one of the two, but I will probably try to run.
I would run.
Yeah, right? Like, oh man. Then the scenario would be okay, the lion is gone, the danger is gone, but I'm still experiencing the fear and the danger in my sympathetic response.
Love it.
That is a form of almost being stuck in inhalation. When we are in inhalation, I usually tell people, I can tell when people have neck pain and chronic neck pain is when their neck muscles are just on point. Because they are upper chest breathing, they are not getting a diaphragm breath, which is in mid thoracic, and they are not able to exhale. So that we need to be in parasympathetic response. And I'll tell you, this will go another podcast, but being in COVID, I have worked more with people because I continued working. I maybe didn't work for a month or two. So I was in the thick of COVID when people were coming in and we were all quarantined, and I would spend more time on teaching people how to breathe. Right. And get the exhalation, do at least 6-second exhalation. It should be longer than your inhalation, and teach people to relax and literally drop their rib cage. And so that part, going back to pain science, is key, because there is this part that's like, okay, maybe that person, there's a part of them that just isn't breathing right. And they're not able to get that relaxation, a parasympathetic response, and they're stuck in this sympathetic response, and they are tight all the time. When people, and pain is so subjective. I mean, Curtis's pain level is different than mine. Athletes typically have high pain threshold. So it becomes this. So let's go back to the female athlete. Let's go back to the whole scenario about this spondy, for instance. What I've noticed with these spondies, and especially when the protocol, if they have a full fracture, their protocol is long. You're looking at bone healing 12 weeks alone. Sometimes they're put in a bob, which is a thick brace that's from their whole torso. They hate it. But the purpose is to allow healing. Then you have 12 weeks being in this brace, and then they're not playing sports. They are getting depressed because they don't have the camaraderie of the team. It's COVID. Okay. And then now they're just like, okay, I can't move because I've been told time and time and again, I don't want to fracture my back and have this long time chronic back pain. So they're told all these things, and it feeds into this pain. And there's a balance of, okay, you're gonna be fine, but you have to, there's respect healing time. I'm big with that. Respect healing time. The creator has given us a body to heal. Our bodies are resilient, especially with athletes, because typically they're healthy people. Your bodies have to heal. Let your body heal. And we have to be careful, because sometimes these people, going back to the spondies, they'll be in a mode of not doing anything. That pain becomes a part of them. And then it's like, okay, I get out of the brace, but now should I move? What do I do? I'm in pain still. No, that's because you're weak. So there's got to be that, the pain. What we find, I'll say one more comment about it. There's actually been a research on this. It's called the Fear Avoidance Belief Questionnaire, FABQ. Google that. Give it to if you're someone that works with clients, give it to one of your clients. And what they found, it's a standardized test that, so for example, one question, it's a questionnaire. They'll say, I believe that I cannot be out of pain. So it's a belief system. And what they found is if they score a certain number higher, they found that these people will not do well with a normal pain, like a normal protocol. You have to do cognitive based things,
right,
and help them. Sorry, my daughter's here. And
no, you're good.
Help them to respond to pain differently, because it's not just about, I have to be careful with, like, always asking a patient pain, like, what's your pain level? What's your pain level? What's your pain level? Because then it's like, but we should be asking, what can you not do? What is your functional, what's your dysfunction that you cannot do? And let's work from there.
I love it.
So.
Yeah, man, I think that's interesting. I think because, I mean, like you said it earlier, but like the pain almost becomes their identity, right? Yes. So I think that like, I am this. No, it's a moment in time to kind of bounce through that, essentially. I think what's interesting about that too is like I was saying earlier about tone and environment. Like I have people, like I had a kid a while back, right? And he ran track at UW. He came in with back pain, right? And his tone was super high, right? And like our assessment, we check breathing, whether they're apical or not, or if one side moves more than another. We also do, SI joint, like they'll do hip flexion, monitor the PSI, so that kind of stuff, which is kind of like the back of the hips, guys. And went through the assessment, came in for part 2, walked him through what I found, got him to learn how to control his kind of pelvis, like hip hike, that kind of stuff. I was like, and he was afraid to deadlift, right? And so I had him walk around after we got 30 minutes in. He's like, dude, I feel really good. I'm like, cool, let's go deadlift. And like literally I saw him go from I feel good, maybe parasympathetic, to like I said that, and he was like, oh. I was like, no, let's go, right? I was like, you got this, right? So I trap bar, loaded the masses around him versus he has to articulate around that. I elevated it first, and I was like, deadlift this. He's like, oh, I can do this. This is fine. I'm like, okay, pick a weight that when you would feel it. And he's like, it's always like 2 plates. Okay, cool, do it. But I want you to think about it this way, okay? We just worked on this today. Hold that in line. Now think about pushing your feet through the ground versus lifting the weight. Don't think like a fishing pole. Don't think like a fishing pole. Shove your feet through the ground. The ground's not going to move. You're not Hulk. You can't break the ground. And he was like, oh my gosh, no pain. Oh my gosh. And he wanted to keep going. I was like, no, let's not push it, dude. You haven't done this.
Right. Find that balance.
Yeah, but he had this aspect of like, man, I'm good. And then from there, he just got better and better. And then he was like, and it was like in the summer before he went to UW, and he was just nervous about the training there, and squatting hurt. And so I think that that's a big factor. And I think that also too, like, I think what's really cool that I heard you, and correct me if I'm wrong, but you were saying like, it sounds like you're educating them to get them to think about, take inventory on their system, especially the female athletes. I think sometimes, it's kind of like when girls menstruate and that kind of stuff, they're like, oh gosh, I'm menstruating, or like, and I've never been there. To me, I'm like, something that happens. You know what I'm saying?
That's right.
And so like I've gotten to this point with some of the athletes I work with that they're comfortable with me. We go on a seasons basis. And so what I'll say is like, hey, I feel like Hutch told me this a while back in premarital, but he would say, ask, he did actually, I'll never forget it, but he said essentially, you can ask in summertime anything, and it's like, yeah, sure. And so I use this system basis or a season basis of asking like, hey, is it winter? And that's all, and nobody else knows. Right. And they're like, oh yeah, oh, it's winter. right? Or
I
or
love
it's
that.
fall,
I love
so
it.
we're on a
Right.
season basis, like, dude, it's
Right.
summer, like, let's test today. You're in summer, yeah, let's do your athletic testing or whatever it is. And I think what's cool about that is they realize, and I'm a guy, I'm not a girl talking to a girl, so like that's a different thing. And so when it comes to that, because it's like, oh gosh, but when they get to the point where they trust me and they're like, I'm just using this information of how we load today, how we do things, and when they see that I'm using it that way, it builds this trust.
That's good.
And because I don't, like, my goal, I don't want to hurt anybody, right? Like
That's right.
that's never my goal, but the whole purpose is to, like, what do you need right now?
That's good.
What is it that you need right now? And I think what's really cool is looking at that. You'll see breathing. I saw it during COVID too. I mean, that's a really interesting thing. I think that whole thoracic spine locking up. And I think another thing I was going to talk about too is one pressure that's put on, I would say more so females than males. I mean, you see it on Instagram stuff with dudes and stuff, but in America per se,
Yeah.
we look at all these magazines, like, and I don't
Yeah.
buy like Vogue or, whatever it is.
Right.
And
Right.
everybody's like, get long and lean, and they'll
That's
like
right.
do this. And all
Right.
that's doing, I believe, is that in their mindset, their environment, it's teaching them to breathe through here because they don't want this to happen with the stomach. But
That's
if I
right.
look at my son, right, he's got a great belly right now. I mean, but they're diaphragmatic breathers, right?
Yep.
Light has none of that stress or that pressure. And I guess for me as a father of a daughter, like, I want her to understand, like, you have a beautiful body. That's how
That's
you
right.
move and to keep it healthy. And I think when they understand, like, that's just an aspect of what you do and
Right.
educating them,
Yeah.
it's great. And I've also found with female athletes, for example, like their ability to produce force and get stronger is much higher than the dudes I work with. And
Yeah.
I don't know if it's because they're more in tune with their nervous system, because every month there's like a recycle essentially, or reset to some
Right.
aspect where I've seen crazy stuff happen. And I think that the breathing
Feelers.
aspect,
Absolutely.
yes,
Yeah. Definite
right.
feelers. Yeah.
And it's interesting, and I think with the whole breathing aspect, how much of a factor do you see, whether it's any athlete or anybody you work with,
Hmm.
how much of learning how to breathe has almost calmed some of those things down?
Yeah. Yeah, I see it a lot. So what I've started incorporating, especially with my spondies, is because 10 out of 10 times the spondee will come in with stiff thoracic.
Feel it.
And so I'll do a lot of foam rolling, kind of basic stretching on the foam roll, some myofascial release on the thoracic with a foam roll, and just have them lay on there and just have them breathe, have them work on diaphragm breathing, focus on relaxing the neck, to have them go into their happy place mentally, whatever that is, and just have them breathe there. And I know one of the PRI exercises they'll have people do is have them lay, not maybe on a foam roll because that could be a little aggressive, but on a towel and lay on it
Mm,
vertically and have them lay opened on their back and breathe there for like 30 minutes and
okay.
relax. I mean, whoever has time for that 30 minutes of relaxation, who does that now? So, and taking that time to understand that pain, to comment on the pain part again, is pain is normal. Pain is good. Pain is our bodies. We have something warning, something is going
Right.
on. But we know in pain science that the threshold sometimes can be more sensitive. So let's say you sprain your ankle and the
Mhm.
tissues heal, the ligaments heal, whatever the healing of the tissue has occurred. But then let's say you sprain it again. Your threshold has now become higher and more sensitive. So then if you keep spraining your ankle, it's like, wait a minute, I'm not going back to baseline because I keep injuring myself. So what happens with that is that that's when it builds more of that, okay, what's going on with that cycle and how do we stop that? Now that's just an ankle sprain example, but that goes with any injury when it
Yes.
becomes like injury upon injury. And I just want to comment what you said earlier, Curtis, because that's so key. I love the fact because what you said earlier shows relationship with your client. And I think that is so important because the client trusts you. They know that you have their best interest in mind and you are back and forth. It's like I told the mom this morning, it's a touch and go. There's no
Right.
perfect. It's just not going to be perfect. There's not.
Right.
I always tell my patients, I want there to be, think about XY axis. I want a linear improvement.
Mm.
That's all I want. But no, you know what? It's going to be sinusoidal, up and
Yeah.
down. But I have relationship just like you have, and I love that because it's like, what is going to work for you today? And I tell people, become a patient. So I'm a patient. I see a physical therapist. I
Yes.
love her. And when you become that patient, she'll actually ask me, what do you want me to work on today? And I'm like, oh, well, you should know. But but it gives that relationship of, you know what, I have a say in this. I have a
Of
say in my
course.
body. I can tell you this is what I think I need. And
Mm,
then the professional, you, me, can say, okay, let's work that out and see if it works.
I
So
love it.
I love that aspect of what we do, and having that relationship with that person. I mean, you know this, Curtis, like I have a patient, one of my gymnasts from back 10, 15 years ago is a chiropractor now. I love
Love it.
it. Like, and he was a gymnast in Michigan. I'm like, I love that.
Yeah.
And it's just that, that's another topic. But
No,
yeah,
it's cool.
so
I mean,
to answer that
it's
though, is
about
I do incorporate that, the breathing, going back to that, I do
good.
incorporate that, have them relax, start the session that way, and then let's roll. Let's see what we can do.
I love it. I love it. I mean, I think it's great. And I think what's cool about what you said earlier too about the ankle sprain and the threshold, right? I got a buddy, Jacques. He teaches. It's called FNS, and his business called Myotopia.
Wow.
And he talked about this essentially. He studies the nervous system effects on the system,
Mm,
right? I've learned a lot from him and so forth. I've been to a bunch of his classes, but he called what you just talked about, that phenomenon. He calls it neurogenic inflammation.
mm,
And so essentially within the nervous system, there is a data bank or a library of there is an injury. Here's the threshold, like a reminder of that. So if you've never had an injury, you don't know how to recognize like, oh, I'm getting there or I've had it.
right.
But if you have it, it kind of kicks back in. So like you said, the actual integrity of the structure may be good, the tendons, the ligaments, the bone, whatever it is, but the sensitivity of that area, it doesn't take as much volume, stress, load, whatever you guys want to call it, to trigger that, and that pulls people back. And
That's
so
right.
I think the fun part about training that, for example, is like when they're in that, they're getting close to that neurogenic inflammation, then you can take, say, the same exercise. Let's just say a lunge, right? So you got somebody doing a lunge and you're having them kind of drive forward with the knee to get some more dorsiflexion. I'm just saying this for this
That's
example. And
good. Yeah.
they've had an ankle sprain, right? Like, okay, I want you to think here versus an up and down. Get into there a little bit, come
Mm,
back, right? Kind of
that's
working
right.
that eccentric control of that, and then they're like, oh, I'm starting to feel it. Well, what would be really cool is if you took a band and unloaded the load, and then they're like, oh, I can still keep going. Oh, that feels okay. And
Yeah.
I think that's the beautiful thing of like when they feel comfortable enough to talk to you about this
Yeah.
pain sign stuff they're
That's
feeling.
right.
Okay, pause.
Mm-hmm.
How can we
Mm-hmm.
now? We got to get some more tissue volume
Mm,
there to get comfortable with
mm-hmm.
that. How do we
Mm-hmm.
change the resistance or how your body's interacting with gravity to get them to feel better? And I think
Mm-hmm.
that comes down to, I think it just comes down to being able to like build that trust. And I think it's
That's right.
crucial, you
That's right.
know, I mean, and I think the breathing's a massive factor, but I think that all those things are a huge factor. There's definitely things we got to think about female athletes, especially when they're growing, or whether what are some things like I had some moms be like, wait, why are you asking me this question on the questionnaire? Like, well,
Right.
which is fine. I mean, and they're like, oh, I'm not just asking to
Yes.
ask it. Like I'm trying to figure out how to go about it and go from there. So
Well,
that's super great, man.
I want to mention something to touch on the point with the pain stuff. There's a book out there you probably heard about, Curtis. It's called Body Keeps Score, and
Mm,
it's incredible. I actually have the book. I read like a chapter and said this is deep, so I'm going to go deep a minute just to touch on the pain science a second.
I love, yeah.
So, what we know in the psychological, mental, physical stuff is that there's actually been research on, for instance, okay, this is going to go deep, but let's say someone was physically abused,
Yeah.
that
Oh, yeah.
sometimes people will hold that pain in a certain area. It could be their neck, it could be their low back. I have a patient right now who has chronic neck pain, and she was abused when she was younger.
Mm,
And it's been hard. It's been really hard to get her better, because from a very young age, as we started digging deep into her issue, from a very young age, the way that she would deal with her stress is she would crack her neck. This
mm,
is a 7-year-old girl that would crack her neck. This girl is 35 right now. And
right.
I can't, I mean, I'm like, I don't know what to do with you. You need counseling, you need medication. I mean, that is not my realm, but that is a perfect example of a pain science that has been so deeply rooted that and I had to ask her that. I'm like, I was getting, making little progress with her. And
Okay.
I'm like, let me, we have that respect. We have that relationship, because over a couple of months, seeing her once a week, I'm like, okay, let me go there. I'm like, tell me when the earliest sign of when you had neck pain. And it was around 7 years old. I said, what
Mm,
happened around that time? And that came out. And I'll tell you, since then, it's been some time, but she's getting slowly better because she's
Right.
seen a counseling. But unless I address that part, her neck will always be in pain.
For sure. And I think what's interesting about that too is we don't go there, right?
We
And
don't
it
go
takes
there.
time. It takes time to build that trust because let's just say like in that role, like that's not my forte, that's not your
It's not.
forte.
Yeah.
Where do we direct them? Because I think ultimately when I've met certain people, they want to put people or help them get, past their or towards their goals. But it may not just be like you said, a mechanical issue. It may be something underlying of like, like I've had people called and they'll be like, well, you don't have a female trainer. I don't want to work out with anybody that's not a female trainer. I'm like, that's totally
Right.
fine. I get it, and I'm not going to categorize them or whatever it is, but it's like, then I do the consultation on the phone and then say they come in. And I'm like, well, why is that? And
Right.
that's okay. And then I start telling about me. I'm like, hey, I'm married. I have my wife. I've been married for this long. I've got a daughter. And then all of a sudden they soften up, which is interesting. And then when they talk to me, they realize like, wow, he's a really gentle, nice guy, and then like, oh, well, this is why. I'm like, that's cool. That's not going to happen, or whatever it may be.
Yep.
And I think that that's a huge thing of like, how can we, and if they didn't sign up here, that's fine. How can I direct them to somebody that'd be great? That's a woman that's can do great in that role or whatever. It's because it's not
Right.
about us. I mean,
Yeah.
it's
Yeah.
about helping that person. I think that if we keep that perspective, it makes a massive difference, and
Right.
yeah, pain science is fascinating. I mean, they've been studying that for so long, trying to figure these things out. Like, can we give a grading scale? Can we do these things? And it's tough. Like there's no way I could probably have a baby. I mean, I feel like I'm pretty tough. And my wife's like, I'm like, wow, you're a boss, dude.
Men have different stresses.
I'm like, whoa, there you go, you're a boss. So which is super cool, man. But dude, I love it, man. Right, exactly. So dude, I think we covered a lot. I think that was good. We could probably do another one too. We wanted to dive in a little bit with asymmetries and approaching the system. We probably do a separate one for that. But I think what we covered today was super fruitful. Like I think it would give a lot of nuggets, and I really appreciate your time.
I appreciate you, Curtis.
You're working from home, and this was a great discussion. And so if people want to try and find you or get a hold of you and ask you some questions, where can they find you? And I'll put in the show notes, guys, but
Sure.
where can they find you?
Yeah. Thank you, Curtis. Lake Washington Physical Therapy. I'm in the Kenmore location. So you can just Google that, Lake Washington Physical Therapy.
I love it. I love it. So yeah, we'll go from there. You guys, if you got any questions for her specifically, she's a phenomenal physical therapist. And as you can tell from this episode, she really wants to know how to help her clients. So, I mean, hit her up if you got questions, especially in the Washington area, or I guess the east side, or I guess you can come over the bridge from Seattle. But thank you guys for listening today. Cynthia, thank you so much for being on.
Thank you, Curtis. Appreciate you, bro.
Yeah. And so we will see you guys next time. Have a wonderful day. This is Curtis and Cynthia signing out.